Perfect. Thank you so much. Just to clarify, hi everybody, my name is Jaime Redondo. I'm a professor of drug policy at CIDE in Mexico City. We are 10 years into the consolidation of a program, the only program looking into drug policy in Mexico. And I used to work for many years now in harm reduction, and I want to introduce what we've been seeing in the Latin America Working Group. So right now, I want to talk about how the region really has a diversity of approaches across the region. I would say that we have broadly three types speaking. One, that it relies more on police response by modifying certain policing tactics or adapting to alternative policing strategies. And we have seen throughout several places in the region. We can see that in the community security bases in Bahia in Brazil, or the project of the PPP or pacifying police units in Rio de Janeiro. Some other approaches have gone more with an alternative non-police response, more about mental health that includes social cohesion and harm reduction actions. Some examples of this can be also found, for example, with the mental health centers in Peru, the newly opened Colibri centers in Iztapalapa in Mexico City, or the Escudo harm reduction project in the border between Mexico and the United States. But others have relied mostly on police and civil society collaboration through sensibilization initiatives and collaboration agreements like Red Trust 6 that we will present a little bit more details on that. What is the current status, however, is that several have existed for decades and are still evolving, consolidating into programs like the community security bases in Brazil. And others have encouraged these multiple goals, including sexual harm reduction actions, sorry there for the mistake. For example, Escudo and mental health centers in Peru. And some have bring together, like I said, police and civil society efforts. This Red Trust X program that will have focused more shows that there's clearly not a clear driver for many of the projects throughout the region. However, what we can find in this success case story is that for more than 10 years, the Red Trust X, which is the network for female sex workers of Latin America and the Caribbean, has worked to try to create a space where police officers and peers, sex workers, can sensitize the police regarding their job, their human rights protections. And the idea there is to have sex workers together with some initial funding from the German embassy, UNH, and the Honduran police, and to have to then replicate this project into many other countries. So some of the characteristics that we can show from this one is that the project, even though they started in Honduras, has led to the design, execution, presentation of these programs with a first-hand advocacy to decrease the stigma, discrimination, and institutional violence for which female sex workers are exposed daily while they're doing their work. So basically what happened is the female sex workers or their peers will train police officers in this collaborative agreement between them and the police so they can decrease the number of human rights abuses. Up to date, the network has sensitized more than 4,000 security personnel around Latin America, and this is what is really interesting, created protocols for police operations throughout the region. Something that we have identified, unfortunately, is that not all programs have reports and best practices that will allow us to replication. However, this project in concrete, Red Trust X, has a strong component of leading the peers into creating these materials so it can be replicated in other settings. However, there are certain challenges that we have seen throughout the region. One of them, and is mainly that the change in government has made it that some of these projects, so for example, the Open Arms in Brazil, that it was a really progressive initiative to do employment and housing for people who use drugs in downtown Sao Paulo, that it was canceled after a government change. Same happened, for example, with Escudo in Mexico. So these changes in government and also the changes in policing linkages with other organizations. Another problem is also the reduce of stigma for community-based organizations, right? That work that has to be done with the police officer is still difficult to tackle. And also it comes to the center that we don't have enough public resources for non-police alternatives. Usually the first approach that it will face is trying to use more the police for tackling all these other problems. And we can see that really right now with the public health emergency of COVID-19, where in some countries the police was used to enforce public health restrictions, such as use of masks in public places. So unfortunately, we rely a lot on international philanthropy to try to create some of these projects. Other the bad things that we need to tackle is the corruption that unfortunately modifies that interaction that exists between citizens and the idea of creating these initiatives. For example, we can see these with proximity policing projects in NESA in Mexico. And clearly, one of the big obstacles in our region is the highest level of violence and organized crime that sometimes gets filtered into the security forces, and then that difficulty is the task of other organizations, either civil society or researchers of us like us, to engage with security forces in the region. But I'll be happy to talk more about this during our Q&A session. I also would like to put here our collaborators, Natalia Campos and Sergio Melvin, who might be around there. And thank you so much. We will be ready for your questions.